Congress, which we are conducting on obstetric anesthesia. Now, this is the first World Congress which has been conducted in this for the first time across the globe, anywhere. And we are fortunate that it is happening in Hyderabad. And we were entrusted the job to conduct it. Now, why we were given this particular, why we were chosen to do this is, we started something called as Prerna Anaesthesia and Critical Care Services. Actually, it's a private limited company, which we registered in 1997. And then we started in a very humble manner that a few of us got together and thought we should get institutional standards into private sector as far as anesthesia practice is concerned. And that way we started this. Among the various types of anesthetic procedures that we do or anesthesia we practice, obstetric anesthesia is one of the specialty which we practice. Now, what happened over the last 20 years, because of our team practice, which went from 4 people to 50 people now, we were able to get the highest volume of obstetric anesthesia. We treated the highest volume of obstetric anesthesia in entire Asia. And we were the first to start labor analgesia services on a massive scale. That is one. The second is what we thought, what we started before anybody else in this country is, we started something called as obstetric critical care services, which is actually intensive care management for pregnant mothers. And the third important thing that has happened is we started something called an high-risk obstetric course, high-risk obstetric anesthesia, and we started 1-year postdoctoral fellowship for anesthetists, which is actually after MD anesthesia. And this has been recognized by the National Association of Obstetric Anesthetists. And then this is the only course that in the country that now they have. And we are taking 2 students every year and conduct this postdoctoral fellowship. Now, all this, keeping this track record, the national body thought that is the first World Congress has to be here. And we actually insisted because it is more pertinent and relevant to our country rather than to any of the Western countries. Now, 4 bodies are there in the world which are very prominent. One is Obstetric Anesthetists Association of UK, they call it OAA. And there is something called as SOAP. SOAP is Society of Obstetric Anesthesiology and Perinatology in USA. Then there is one more body in Asia region. Asia, we call that as Obstetric Anesthesia Society of Asia Oceania. Now that is, there are 2 bodies merged together. You have one president for Asia, one president for Australia, Oceania. So these 3 plus the Association of Obstetric Anesthetists of India. These 4 bodies are coming together and conduct this first World Congress. And we were actually the hosts for that. So the elaborate scientific program has been created for deliberations among all the international faculty. There they achieved fantastic results. They standardized obstetric anesthesia practice in the Western countries, especially UK and USA, because they started something called as confidential inquiries into maternal deaths, and they were doing it for almost last 4 decades. They were also having very high maternal mortality. Now they, after doing all this doing this year-on-year confidential inquiries into maternal deaths, they were able to analyze the data of why mothers were dying during pregnancy, and then enhance the practice and enhance the scale of practice and standardize protocols of anesthetic practices. Okay. And then as a consequence of that, there is a drastic reduction in the maternal mortality. Now, if you ask me, there is almost they have achieved a near 0 rate in UK and USA. They don't generally die when they go into, however high risk the pregnancy may be, when they go to medical attention inside the hospitals. Now here in India, it's not the same scenario. We have still very high maternal mortality despite coming to medical attention. When they don't come to medical attention, well, that is main reason why most of the mothers are dying. But even when they come to medical attention, inadequate infrastructure, inadequate understanding of the pathophysiology or the physiology of pregnancy, and then inadequate understanding or inadequate knowledge base for management of high-risk obstetrics, and inadequate infrastructure to institute critical care practice in the medical setups. All these are there. Now, in this, what we are trying to do is, how do we get some standards into practice of obstetric anesthesiology in this country? I think that guidelines, there are 10 guidelines that have been framed, which will be released during the conference on 12th in the inaugural session. So we have put 4 different workshops on day 1, which are one is on advanced labor analgesia, second is on critical incidents in obstetric anesthesia, third is the obstetric critical care, and fourth is high-risk pregnancies. So 4 workshops, and they will have all the simulations and live hands-on experience we will give them. Each workshop, there are 80 participants registered. All will have first-time experience of doing something on a simulator. Then on 12th, we have a day-long scientific session on 12th and 13th, where most of these international faculty would be exchanging their views and the type of practices they do in their West. And then, the national faculty will be there, a lot of panel discussions, and also we are releasing a 10 guideline charter on this conference. Hopefully from that will become a norm in the country for all obstetric anesthetists. And let us see how things progress. We make this attempt, and hoping that will create some value to the society, and then in general medical practice and to the society. Okay, thank you.